Welcome to Ortho Reports. Today, we're jumping right into a really fascinating clinical case. It's a story that kicks off with a high-speed car crash, but you won't believe where it ends up, with a totally unexpected and, honestly, a pretty terrifying complication right there in the operating room. Let's get into it.
Okay, so try to picture this scene. A patient is waking up from surgery. The procedure on his hip, it was a success. But as that fog of anesthesia finally starts to lift, a whole new reality hits him, and it's panic. He can't feel his arm. He can't move it at all. What should have been this huge moment of relief turns into a moment of just pure terror.
And that right there is the central mystery we're going to unravel in this explainer. I mean, think about it. The injury was in his hip, but the devastating outcome was in his shoulder and arm. So how on earth did the surgical team get from point A to point B? Well, the answer is buried in the details of a very, very long day in the operating room.
To really understand what went wrong, we've got to go back to the very beginning. So let's meet the patient and take a look at the trauma that brought him to the hospital in the first place.
So our patient is a 16-year-old kid. He was in a serious car accident, what we call a high-energy trauma, and it resulted in a very specific and very severe injury, an isolated fracture of his left acetabulum. Now, what's really important to note here is that this was his only significant injury. His arms, his head, everything else was checked out and totally fine before he ever went into surgery.
So what even is an acetabulum? Just think of it like the socket part of your hip's ball and socket joint. It's a really deep, pretty complex structure, and fracturing it is a major orthopedic event. Fixing it takes a highly skilled surgical team and a super precise operation to get all those pieces back together just right. All right, let's head into the operating room because this is where all the clues to our mystery are hiding. You'll see, the procedure to fix that acetabulum was long, it was complex, and as it turns out, every little detail matters. Okay, clue number one is the duration. 10 hours. That is a massive amount of time for a body to be under general anesthesia, lying completely still on an operating table. This kind of marathon procedure time is a known risk factor for complications, simply because of the prolonged stress it puts on the entire body. And this right here, this is the most critical piece of the puzzle. The patient was initially positioned on his back, with his arms out to the side at a safe 90-degree angle on arm boards. But somewhere in that 10-hour window, there was a staff change. A brand new anesthesia team took over. And when the drapes were finally pulled back after the surgery was done, the surgeon discovered the patient's arms weren't at 90 degrees anymore. Nope, they were hyper-abducted, stretched way up above his head in what the report actually calls a Superman position.
So now we're back in that recovery room. The patient is terrified, the medical team is completely alarmed. The immediate fear was something absolutely catastrophic, like a stroke. The team had to move fast, really fast, to figure out what was actually going on.
The first thing they did was rule out the absolute worst-case scenario. A stroke code was activated and a CT scan of his brain was ordered right away. But the scan? It came back completely normal. Now, that was a huge relief, of course, but it still didn't explain the paralyzed arm. With a stroke ruled out and thinking about that weird arm position, the neurologist landed on a new diagnosis, which was then confirmed by the physical exam. Brachial plexus neuropraxia. So what is that, exactly? Well, the brachial plexus is this complex bundle of nerves that runs from your spinal cord in your neck, goes through the shoulder, and all the way down into your arm. It basically controls every single movement and sensation. Neuropraxia, that's a type of nerve injury where the nerve gets stretched or compressed so much that it just stops working. But here's the key. It isn't permanently severed. That Superman position had stretched this nerve bundle for who knows how long, causing a complete but hopefully temporary shutdown.
The good news about neuropraxia is that in most cases, it is reversible. But the journey back for this patient was going to be a long one, requiring a ton of patience and rehabilitation. So let's take a look at how he went from zero function all the way to a full recovery.
What's really incredible about this timeline is seeing the recovery happen step by step. Just 3 days after that terrifying discovery, there was a glimmer of hope. A tiny flicker of movement in his fingers. By 1 month, he could extend his wrist. At 3 months, his elbow movement started to come back. And finally, after 6 long months of therapy and healing, he got a full recovery. We're talking full motor power and full sensation. Just a truly remarkable outcome. This case, even with its happy ending, serves as a really stark warning. This was a completely preventable iatrogenic injury, which is just a term meaning it was caused by the medical intervention itself.
So the most important thing here is to understand the lesson learned to make sure something like this doesn't happen again.
This quote from the authors of the case report really gets right to the heart of it. Patient safety isn't just about the specific body part being operated on. It's about the whole patient for the entire duration of the procedure. It really highlights that shared responsibility between the surgical team and the anesthesia team.
So, how do we prevent this? Well, it all comes down to vigilance, meticulous positioning and padding right from the very start. But most importantly, constant communication and reassessment, especially during these really long surgeries, and critically, during team handoffs. Every single time the patient is moved, even just a little bit, their position has to be rechecked from head to toe, no exceptions.
And this really leaves us with a powerful question to think about. When the entire surgical team is intensely focused on a complex hip fracture for 10 solid hours, whose job is it to protect the patient's arm? The answer, as this case makes painfully clear, is everyone. It's a fundamental part of patient safety that can just never be overlooked.
What a fascinating case. A really difficult journey, but such a crucial lesson. Thank you so much for joining us for this Ortho Reports Explainer. We'll see you next time.